my name is Holly Smith, and I am here to discuss with you a comprehensive strategic and marketing plan for the addition of a short-stay surgical unit dedicated to post-knee replacement patients. Where we would be implementing this unit is at Texas Health Southwest Fort Worth, which is a nonprofit, faith-based hospital with 500 beds. Texas Health Southwest is located in Tarrant County and serves the communities of Tarrant and Parker County. Combined, those counties have an estimated population of 2,109,638 people. It's conveniently located for those communities and is easily accessible. This project would fit into the mission of Texas Health Southwest by improving the health of those that are wanting knee replacement surgery. The vision would also be represented in this project because it is partnering with the patient to implement a lifetime of health and well-being. It also will be integrated, the values will be integrated in the project as well. The services currently offered are labor and delivery, neonatal ICU, an emergency department, behavioral health, and surgery services. This new unit would fall under the current surgery services that are offered. Now I'm going to share with you some demographics. The most common age of those needing knee replacement surgery are those 65 and older. In Parker County, 14.8% of the population is over the age of 65. And in Tarrant County, 10.5% of the population is over the age of 65. An addition of the short stay unit would be dedicated to the care of patients who have undergone knee replacement surgery. A coordinated, seamless care model of care would be implemented. The goal would be to decrease readmission from complications. The unit would provide pre-surgery education to those undergoing the surgery. It would communicate with a primary care provider. It would do comprehensive discharge teaching, and follow-up phone calls would be placed to patients after they are discharged. Goals of the strategic plan is for Texas Health Southwest to become the hospital of choice for the communities it serves by improving the quality of life for patients that seek knee replacement surgery. It's also a goal to improve clinical outcomes. Evidence-based protocols to provide high-quality perioperative care will be implemented. Also, a goal is to increase revenue of the hospital. So here is our timeline, and I'm providing a 3-year overview. The first year, we would remodel space that's already at the hospital to add 20-bed short-stay unit focused on the care of those that have undergone knee replacement surgery. It will begin in October and expected to be completed in 18 to 24 months. In year 2, we would start recruiting staff and hiring staff, providing orientation and marketing for the unit would be increased. In year 3, we would hope to have the unit open and running. So we did a SWOT analysis. We reviewed the strengths, weaknesses, opportunities, and threats of adding a unit to the hospital. A strength is that Texas Health Southwest has a clear mission, vision, and values and a great location. A weakness would be adding a new unit. This unit is not currently at the hospital, so it would be a weakness to add something new and different that has not been done before. Opportunities are it's the only comprehensive hospital in Southwest Fort Worth. One threat, though, is that 8 miles away, located in the busy downtown center of Fort Worth, there is Baylor Scott & White All Saints Medical Center, which does offer total knee replacements and care afterwards. Next, I would like to share the marketing plan, starting with a marketing share analysis. First, let's review what competition is located within 3 miles of the hospital. The Heart and Vascular Center of Fort Worth, Life Care Hospital of Fort Worth, Kindred Hospital Southwest, and Encompass Health Rehabilitation Hospital. These hospitals are located within a short distance of Texas Health Southwest. While they do not offer the comprehensive care of Texas Health Southwest, they do offer some services. The payer mix that we are expecting is a mix of managed care, Medicaid, Medicare, private pay, workers' comp, and other sources. To make this a more profitable unit, we would try and increase our private pay customers to increase revenue. Our marketing plan. We have a budget that has been set, and these are the activities that would be promoted. We would update the website to have pictures of the remodel and show progress to our customers. We would launch a social media campaign, and we would make sure that we have search engine optimization because we want our website to pop up when people are searching for knee replacement information or local hospitals. We would educate our current employees on what the unit is and what it will be doing. We will have media and waiting rooms throughout the hospital. So we will record a special commercial that explains what the unit is and why it's going to be built and when it should be expected to open. And it will be played on all of the TVs and media in the waiting rooms throughout the hospital. We also will print brochures to hand out to customers and to local surgeons and primary care physicians. So the personnel that we need to hire to have this marketing plan implemented. We need to hire a communications coordinator. We need to hire a search engine optimization consultant. That person is not needed full time, so that's why we are only going to need a consultant for a short amount of time to first start and set up those search engine optimization parameters. Then we also will hire an administrative assistant to help with these tasks. Here's the time frame. So in August, before construction begins, we will go ahead and post a communication coordinator position and administrative assistant position. Once the construction begins, we would hopefully have those people in place. The web page would be launched, the SEO consultant would be hired, and current hospital employees would be educated. In February, we would make sure that the hospital media is ready and the commercial has been implemented throughout the hospital. In May, we would launch social media campaigns, and in July, we would begin distribution of brochures to those physicians and surgeons around the area. I would like to review who this marketing plan is targeting. It's targeting those who need knee replacement surgery. It's targeting nurses because we want nurses to come work on our unit. And we also are going to be targeting orthopedic surgeons. We want surgeons to come and perform their surgeries here and know that their patients will be receiving excellent care. We will review outcome measures monthly. We're going to look at the budget and make sure that our timeline for promotional activities is on target. We will utilize customer surveys and surgeon surveys to make sure that the stuff that we have implemented is actually doing what we want it to do. Next, I would like to review potential disruptions to the plan. One thing that might disrupt our plan would be if we were to lose orthopedic surgeons and they were to go to another hospital. What we could do then is to utilize other surgery services to allow them to use the unit. Another thing would be a delay in construction. If we have hired staff and we don't have a place for them to work, one thing that we could do would cross-train them and utilize them throughout the hospital until the construction is fully done. Now that we've reviewed potential disruptions, I would like to show where I don't think that's going to happen and the positive stuff that we are expecting. This slide is showing you the projected volumes. We are expecting to see a 10% increase in patient days between year 1 and 2, and a 14% increase in patient days between year 2 and 3. That increase also correlates to an increase in projected revenue. So this slide shows you between year 1 and 2, we could potentially see an increase in 10% of projected revenue, and between year 2 and 3, that we expect to see a 14% of projected revenue. In conclusion, the data that has been shared supports the recommendation of implementing this new unit, and I hope that I can count on your support as well. Thank you for your time.